So at this ASH 2024, we presented some data in the form of poster, was what's presented on Sunday, analyzing the outcomes of patients with relapsed refractory follicular lymphoma who received CD20, CD3 targeted bispecific antibodies according to the prior exposure to bendamustine. So we know from the CAR T-cell setting that prior bendamustine exposure prior to leukapheresis for CAR T-cell manufacturing can have a negative impact on outcomes. If exposure has been recent, within 6 to 12 months. So we extrapolated that hypothesis to the bispecific antibody world, another T-cell redirecting strategy, and asked the same question. And our findings were to some extent surprising. We did not see that same negative impact that we saw in the CAR T-cell setting. In this abstract specifically, we analyzed close to 100 plus patients with this relapsed refractory follicular lymphoma receiving the bispecific antibodies. Of these, 20 plus patients had been exposed within 24 months of bispecific antibody start, and we compared them to patients who had not been exposed to bendamustine. And we did not see significant differences in terms of response rates or in terms of progression-free or overall survival. However, it's true that we do need larger numbers to confirm these findings, but this is important data for the sequencing of all these T-cell redirecting approaches we have for follicular lymphoma, CAR T-cell therapy, and bispecific antibodies. So for instance, if a patient has been exposed recently to bendamustine, this data potentially could support the choice of a bispecific antibody for this relapsed refractory follicular lymphoma patient, and then CAR T-cell therapy could be an option down the road.